The first of the categories of therapies that we're going to discuss is going to be the psychodynamic therapies. And I'm sure you know what I'm going to say already. As soon as you see the word psychodynamic, and especially once we start seeing psychoanalysis, you should start thinking about Freud. So, our psychodynamic approaches are basically going to be focusing on all that stuff that we automatically associate with Freud, things like internal conflict and all those unconscious factors that are going to be underlying our maladaptive behaviors. So, psychoanalysis comes from Freud and his original theories. We've talked about Freud quite a bit, and you kind of have to talk about Freud in most psychology courses, but we had talked about him most in depth in terms of personality. But psychodynamic stuff, and specifically psychoanalysis, doesn't only apply to personality. The name is going to be shared by a specific approach to treatment that he also developed. So, same basic principles. We're going to be talking about psychoanalysis here in terms of not just personality, but also in terms of treatments for different psychological disorders. So, keep in mind that the modern version is heavily modified from what Freud had originally proposed. So, when we talk about sort of are more condensed versions of psychodynamic perspectives, then it's going to be a little bit more applicable to modern life. But I always give that disclaimer just in case. So, based on Freudian principles, unconscious things, maladaptive interpretations of stuff, internal conflicts, and striving to keep from acting on impulses. That's the stuff that we're thinking of for psychoanalysis. And so the goal of psychoanalysis is to help patients achieve what they call insight. And insight is going to be some kind of conscious awareness of the psychodynamics underlying problems. Basically, the idea here is that people are repeatedly facing their buried emotions, buried motives, conflicts, those things that we call psychic energy. That have been sort of acting under the surface. And when a client, the person in therapy, receives insight or obtains insight, they sort of clue into what's going on. They become consciously aware of those factors that are underneath the surface. And once they've obtained this insight, once they realize what's going on, they can start adjusting their behavior. These behaviors usually having been caused by problems that they learned in their childhood, something deep and suppressed, of course. And once they've had this insight, they can start learning to keep that unconscious conflict under control, redirect it, release that energy into more adaptive ways of living. So that's what we're striving for with psychoanalysis. But how would people actually go about doing this? So what is a therapist doing when they're going through a psychoanalytic type of therapy? So Freud would theorize that our mental events are meaningfully associated with one another. Basically saying that everything that we were thinking, all of the stuff going on in our head, our thoughts, memories, the images that we're experiencing, feelings that we have are all related. And so what we are actively experiencing could provide clues to our unconscious. So if we could understand what was going on in our head, what was flowing through our minds, it could give some insight into what was going on unconsciously. And so this is where free association comes in. So free association is basically an uncensored conversation. So the therapist would have the client recline on a couch and verbally report what they're feeling, seeing, thinking of, that sort of thing. And so the therapist, usually at the beginning, it would just be Freud himself, they would sit behind the couch, behind the subject to avoid influencing that stream of thoughts. They wanted sort of a direct line to their internal monologue, their internal stream of consciousness. So if they couldn't see the person doing the therapy, then they weren't influencing that stream of thought. And they would ask the client to give a verbal report of their thoughts, feelings, and images that would enter their conscious awareness without censorship. So say the first thing that pops into your mind. Don't try and hold anything back. Now, the therapist didn't necessarily think that this would lead directly to the unconscious process that's causing the problems. But they figured that this free association would give them hints, provide clues that they could then interpret to get at what was going on unconsciously. So, for example, if this stream of thoughts would suddenly end as soon as a topic came up, then you probably think that you had activated some kind of repressive defenses that are telling us that that topic is a sensitive one, and therefore it's probably an important one to get at. Another process that they used would be something like dream interpretation. And as we talked about in terms of psychodynamics and dream theories, maybe if not in this course, then back in 104, dreams are thought to express our impulses, fantasies, and wishes, the things that are usually hidden behind our defenses. So dreams allow us to bleed off some of that psychic energy from repressed urges in a way that isn't really detrimental to our everyday lives. So the therapist's role would be to help clients understand the symbolic meaning of their dreams. And they might actually use free association to do this. So you might say that I had a dream about riding a train. And so the therapist might ask, okay, well, let's think about trains. What do trains make you think of? What do you associate with them? So what kind of stream of consciousness comes up when you think of trains? And you can go from there. Now, even though clients would choose to go to their therapist for help, they're usually unconsciously invested in maintaining the status quo. People have these unconscious issues for a reason. Something has gone on. Maybe those unconscious factors are protecting us from experiencing something bad. And all of that can build up and lead to avoidance patterns that may pop up during therapy as resistance. So resistance is going to refer to our defensive maneuvers that hinder the process of therapy. So it's a sign, if you see these resistance factors, that anxiety arousing material is being approached. So the closer you get to topics and subjects that cause you intense anxiety and are therefore probably related to the unconscious problems that you're experiencing, it's telling you that you're getting closer, and the clients would then want to get away from that. They would resist sort of opening up that can of worms. And so you can see resistance in a bunch of different ways. Things like difficulty with free association. Maybe you don't talk as freely, or maybe you start hiding some of the things that you would have freely associated with a particular topic. Or maybe your free association stops because it's being repressed. Could also have people who start showing up late. Maybe they don't want to be there, so they're resisting by spending less time there. Or the ultimate resistance is to stop showing up at all. Clients may choose to avoid certain topics that are too sensitive. So exploring the reason for this resistance can be insightful because it kind of tells you, at least they thought, that you were on the right track. The next factor that we might start seeing in psychoanalytic therapy would be the concept of transference. And transference happens when the client starts responding irrationally to the therapist as though they were an important figure from the client's past. So even though this psychoanalytic setup is so that the client doesn't actually see the therapist, Freud would sit behind the couch out of sight so that they wouldn't make that direct connection. But over time, the client starts to project onto them. And that's the process that leads to this transference. And transference is actually one of the most important processes in psychoanalysis because it's bringing out these repressed feelings and maladaptive behaviors out into the open. So the textbook uses an example of someone who starts talking to their therapist and says that they don't trust the therapist. They feel unsafe, like it isn't going to go well if they trust them. And when they dig deeper into it, it's because of this feeling of transference where they're not trustful of their therapist because they are untrustful of others in their lives. And so that sort of acute untrusting leads them to figure out that that's probably what's going on and it's related to someone else in their life. And then once you know that that's the problem, you can start getting to the root of solving that problem. Now, there are two different types of transference, and they're pretty intuitive, I suppose, in their naming. So you can have positive transference, so feelings of affection, dependency, love. So if you start associating the therapist with someone who had a positive influence on your life, someone you loved, someone you depended on, someone you cared for, then you can start feeling those positive feelings towards the therapist. So maybe the therapist takes on a maternal role and you start feeling that motherly love for them because they're sort of being transferenced as your mother. You can also go the other way. You can have negative transference, where you have these irrational expressions of anger, hatred, disappointment. So if you put the therapist into the role of someone that you dislike, someone that you feel negatively towards, then you end up with this negative transference. And both are useful because they're bringing those feelings out into the open. And so the last part of talking about psychoanalysis is to talk about interpretation, which I've kind of snuck the word into our discussion already. But interpretation are going to be statements that are by the therapist. So the therapist is going to make some kind of statement, some kind of interpretation of what the client has said. And they're trying to provide the client with insight into the client's behavior. So the therapist is trying to explain what's going on to the client. But the catch here is that the client has to make that connection themselves. So the client has to arrive at that insight. Basically, if you try and talk about something too deep, something that's too repressed, Freud would figure that the client would just outright reject that insight. They would reject your interpretation because they can't make that connection. They can't arrive at that insight. But if you make interpretations about things that are just beneath the surface, things that the client is close to grasping, but they just need a little nudge, they're going to be a little bit more likely to accept that interpretation and arrive at that insight. And so if the client makes that decision of them on their own, if they make the connection themselves, it's a lot more powerful and it helps them overcome things a little bit faster. Well, a lot faster. Now, because this is the end of psychoanalysis, this is where I tell you that this isn't a widely practiced type of therapy anymore for a lot of reasons. We've already talked about some of the downsides of Freud and his theories where they're very outlandish and not necessarily well respected or well supported. So we won't go into that in too much detail again, but we'll focus on something that transitions us into our next type of psychodynamic therapy. And we'll say that classical psychoanalysis is time-consuming. So the goal of classical psychoanalysis is to actually try and rebuild the client's personality, which is where we get that overlap with personality and psychoanalysis. But with the original psychoanalysis and that kind of therapy, clients would meet with their therapists up to 5 or more times a week, and they would do it for many, many years on end. That is completely impractical in today's day and age, and quite impractical at the time as well. But when you're trying to completely change the person's ways of thinking and how they interact with the world and their whole personality, it does have to be extensive. But then we come to our next concept, which is going to be brief psychodynamic therapies, which are going to be much more condensed, much shorter sessions that have a much less intense scope. So instead of trying to rebuild a client's entire personality, what if we just focused on the specific problems? And so I'm going to start by saying, well, why do we think that it would be valid to switch from like meeting multiple times a week for multiple years? How do we think that meeting for short periods of time is going to be even remotely effective? And the answer is that there have been tons of studies that have looked at this, because if we can have shorter sessions or fewer sessions or more infrequent sessions, then it's going to save sort of time and energy and commitment, because if you can accomplish the same amount of change in 20 sessions as you could in 200, wouldn't you go with the 20 sessions? So we have on the screen here a graph that's just talking about sort of a generic measure of improvement. So this is telling us how much improvement we're seeing in clients over time. And then across the bottom, we have number of sessions. And so this is sort of, there's some weird units here, but basically how we're going to interpret the graph is that here we have a very large number at the sort of 1 session line. So this is telling us that early on, for the first couple of sessions, we see pretty large amounts of improvement. So our improvement score is fairly high. And so in our earlier sessions, up to about this 10th session, we start seeing sort of a pretty significant, a pretty sizable chunk of improvement over time. After the 10th section, our improvement levels out. So there's a little bit of an upswing here, but the score at 10 isn't really significantly different from the score at 20. So from this study and many others like this, they could find that there isn't really a significant improvement after you hit that 10 session mark. So most different types of therapies, they could get the job done sort of within a reasonable amount of margin by about 10 sessions. So the amount of benefit that you get from each section decreases over time. So this is kind of our sweet spot for number of sessions. And so all of this is just meant to say why we thought that it was okay to go from having hundreds of sessions down to having, say, 10 or 20 sessions. And the reason is because we're seeing about the same level of improvement. And of course, there's the caveat that for some specific cases or some specific disorders, more long-term treatment is going to be better, but in many cases, brief treatment is going to be sufficient. So that's our disclaimer to start talking about this brief psychodynamic therapies as a category. And so we can say that, like we said already, brief means more economical. So you don't have to go as often. It's saving you time, possibly money if you're paying for the therapy, so on and so forth. The setup is going to be fairly similar to the classical psychoanalysis because we're focusing on maladaptive past influences and we're trying to relate them to current maladaptive behaviors. And we're still making use of insight and interpretation, but instead of the more passive setup that we saw in our classical psychoanalytic theories or therapies, now we're going to be focusing on something that's a little bit more active and focused. So instead of having the therapist sit behind the client, they're going to sit facing each other and they're going to have a conversation. So instead of free association, you can have an actual conversation. They would meet once or twice a week for 10 or 20 sessions, and they would focus on trying to deal with specific life problems or one specific problem. So instead of trying to build the whole personality up from scratch, you're focusing on one thing or a couple of related things that are causing problems. And one specific type of this brief psychodynamic therapy would be interpersonal therapy, which is highly focused and is only going to last about 15 to 20 sessions on average. Again, there's some variation depending on individuals, but it's going to focus on the client's current relationships with important people in their lives, and sort of dig into interpersonal issues, things like marital problems or changing relationships or even social skill problems. And in this case, we start seeing active collaborations between the client and the therapist to try and find a solution to that particular problem. Now, this is actually one of the most effective and useful ways of treating depression. And it's also really useful for treating somatic system disorder, which we talked about in the last chapter. So, this interpersonal therapy is actually still widely used today and is fairly effective in its use.